Hi, let me introduce you to Buddy. He's a 9-year-old, lovely guy, hasn't been in a CS for about 2 or 3 years. Came in a couple of days ago because of this swelling here. And if you've been watching our videos, you'll know that that's typically related to a tooth root abscess of what's called a carnassial tooth, which is that tooth there. And if you have a really careful look, it's actually got a fracture under here. I can feel it. But so he's come in today to have that tooth removed. And as we do for most of our patients, some clients elect not to have it done, but where we can, we strongly encourage them to run some pre-operative blood tests. Now, he's a perfectly healthy looking boy, heart normal, lungs normal. Everything's hunky-dory, but his owner said, yep, Bill said, yep, go ahead and run some pre-op blood tests. Probably won't find anything, but if you do, at least we'll know how to manage the anaesthetic. Interesting, we did find something. So if you just follow me to the machine, the first thing you can see here, these 3 things are his red cell count. So they're a little bit low, so he's borderline anemic, but not everything else in the red cell and the white cell count is okay. So that's interesting, nothing to be concerned about, but interesting. However, when we look at his glucose, it's 22.69, normal's 4 to 8. So he's a diabetic. And then if we have a look a little bit further down, these are his liver functions, ALT and ALP. And you can see his ALP is over 2,000 and normal is 23 to 212. His ALT is up a little bit as well. So this is also typical of a diabetic. So he's a diabetic, which means we're going to manage his... So perfectly healthy looking dog, yet we have blood tests indicating diabetes. When I rang Bill up to talk about it, he said, it's funny, I've just noticed him drinking a little bit more recently, but I put it down to his age. So we were really lucky with this guy because we wanted to do blood tests. Owner said yes. We found he's a diabetic. We've already got him on insulin. We're going to manage the anaesthetic a little bit differently. But what we've got now is Bill, who has not yet, Buddy, who has not yet gone into a diabetic crisis, and he would have gone into a diabetic crisis in the near future. So we can now get that diabetes under control a lot more easily with a lot less risk and a lot less hassle than if he'd, crashed and gone into a diabetic crisis. So it's interesting that how often we see this. We get so many old dogs in, and when we do their annual health checks, we typically run blood tests, just a mini profile just like this, or when we get them in for anaesthetics, run a mini profile like this. And on a regular basis, we see stuff that we dig deeper and find something that we need to do something about. So the moral of the story is, even though a pet may look perfectly healthy, hale, hearty, and happy on the outside, sometimes on the inside there are things percolating that we can do something about if we can find out about it early enough. So, moral of the story is, any pet that's over 7 or 8, we need to run once a year a mini profile like that to see what's going on. You or I would have that done when we go to our GP for a health check once we're over the age of 60. So it's really good medicine for our pets as well. Cheers, see you on the next video.